Hello, my name's Rian. I'm one of the anaesthetic CT1s here at Colchester, and this is Tanesha, another CT1, and this is Dev, again another CT1. So we're going to go through the donning and doffing procedure for being involved with COVID patients in either if there's an aerosol generating procedure being performed or within an ICU or theatre setting predominantly. So there is a special technique with the way in which you need to put the gown, put the equipment on and then take it off to prevent any self-contamination. So to start with, we'll go through the donning side of this. So we'll start with washing your hands before you get going. And then you need to put on your long-sleeved, water-resistant gown. This is not a sterile procedure. This is for personal protection side of things. You have to have a buddy with you. That's what Dev's here for today, to make sure that you're putting it on correctly and to make sure everything is covered. So you don't do up the inside of the gown because that makes it very difficult to take off in a safe way, and you make sure you do it up on the side in a bow so that it's easy to take off again at the end. So next is to put on your previously fit tested FFP3 mask. You want to make sure it's fitting neatly around your face and is moulded around the nose and your cheekbones, and to make sure it's sealed at the bottom. Every time you put on a new mask, you need to do a self-fit test to make sure that it is fitted properly. So that is putting your hands around the edge of the mask and blowing out sharply to make sure there are no leaks. Okay. Once that's done, it's time to put on the surgical cap. Make sure it covers your ears, and then it's visor. And then the final thing are your gloves, and you need to make sure the gloves go over the cuff of the gown so that there's no chance of any skin being shown. And then at this point, your buddy comes round and double checks that there's that the cuff of your gown is completely inside your gloves, that there's nothing showing at the back, and your scrubs are completely covered. If you have long hair, also make sure your hair is completely within the surgical cap. Now you're ready to enter into the appropriate setting. So now we're going to go through the doffing procedure for taking off your PPE once you are leaving the clinical setting that you're in. You initially start by taking off your gown and gloves in the designated area for that clinical setting. So you start by undoing the bow at the side. Again, I should say this should be a two-person technique for taking off the equipment to prevent any cross-contamination with yourself and the personal protective equipment. So you undo the bow at the side, you then pull the gown down from the front of the gown without touching the sides and release it from the neck. It is very important here at this point that you do not touch the front of your gown and that you take your gloves off at the same time as removing your gown. This is then disposed immediately into the clinical waste bin for the area. You now wash your hands with soap and water for 20 seconds. And now enter the next area designated in your clinical setting for the removal of the rest of your PPE. Here you take off the visor first. You remove the elastic from the back of your head, not touching the front of the visor at any point. And that again gets dropped straight into the bin, and you wash your hands with sanitizer in between each of these tasks. Now you remove your surgical cap, again from the back, not touching your own hair and making sure you don't touch the front of the surgical cap. Wash your hands again. If you wear glasses, at this point, this is when you would take your glasses off and clean your glasses with an alcohol wipe. Finally, the last stage of this is to remove your FFP3 mask. Again, you remove the elastic from the back of the head. You do not touch the front of the mask at any point. Now you wash your hands again with sanitizer or soap and water. So you've removed all of the personal protective equipment, but what is important now is that you go and remove the scrubs that you're wearing, you shower and you wash your wipeable shoes.